Good afternoon. It's lunchtime. Welcome, everybody. My name is Riggs. I'm from 103.7 KISS FM in Milwaukee, Wisconsin. It's an Odyssey station. Also a pretty strong mental health advocate. It's Mental Health Awareness Month, so welcome. We're glad you could join us today for our Facebook Live Q&A with Rogers Behavioral Health. Today we have Rogers Dr. Jerry Halverson, the Chief Medical Officer, with us today, and Sue McKenzie-Dicks, who's the VP of Healthy Culture. We're going to be discussing kind of the do's and don'ts today when talking about mental health and stigma, because there's a lot of things we can say to help support somebody that may be struggling, but there's sometimes things that we say, we may be well-intended in what we're saying, but we may be doing a little bit of harm and helping to perpetuate those stigmas. So that's what we're here to talk about today. So we have two professionals here to help us answer these questions. If you have any questions, please let us know. Dr. Halverson and Sue, thank you for being with us here today. Dr. Halverson, you want to say hello and introduce yourself?
Great. Hi. It's great to be here, Riggs. Thanks for being here. I'm happy to be here with Sue. This is a really important topic that you're bringing up here. I think it's an important topic in the best of times. But as we know right now, we're not necessarily in the best of times with the pandemic going on, hopefully near the end. But certainly we've seen brought out a lot of these types of conversations. There's been a lot of people that haven't had mental health struggles before that are having them now. People that have had them in the past are having them now. But we're still having the same types of conversations of how can we talk to people? How can we get them to the treatment that they need? Because we know that that's the sad thing about this. These are totally treatable conditions. So I'm excited to talk about it. Thanks.
Nice. And Sue.
And yeah, glad to be here. Always like to have the opportunity to talk about real communication and what we can do to make a difference in people's lives. And I find what we're going to talk about today to be about the stigma around mental illness, but I think it's going to relate to a lot of things in our lives where we wonder what to say and how to handle it. So hopefully it's helpful in many areas.
Absolutely. So let's get started with some questions. If you're watching today, please feel free to drop some comments, some questions in the comment box, and we have people that can get those to us, and we'll make sure that we answer your questions to the best of our abilities at the end. So Dr. Halverson and Sue, when we have a friend or a loved one who's dealing with a mental health, like a condition or an illness, a lot of times people may not know what the right thing to say is. So we may want to offer some comfort, some support to these people, but we might be worried about how our words are interpreted. So how does the stigma surrounding mental health overall impact a person, and how is it connected to how we talk about mental health in general?
There's a lot in that question, so I'll take a part of it. I'm going to focus on the person who wants to be a helper and how their own stigma might impact their ability to help. And so when I think about it, like if I boil it down, if I want to offer you help, I want to be able to listen without judgment. And that means without saying my judgmental things. Sometimes things come around in my head and I need to be self-aware to keep my judgments in the back and be able to listen to you without judgment. I want to validate whatever your current reality is. I don't need to change it or try to alter your thoughts on it. And then I want to support you to the next step, whatever you think the next best step for you is. So if I keep those three things in mind, there's a kind of stigma called weakness stigma, I like to refer to as weakness stigma, that might get in the way of my being able to help you. Sometimes we think that because someone is dealing with depression or anxiety or another form of mental illness, that they can't make decisions for themselves, that they don't at some level have some wisdom that they can pull up and use in this particular situation. And so as a helper, instead of helping you to think about what's right for you, I step in there, as the savior trying to help you because you're so weak right now. And that stigma, weakness stigma, really gets in the way of me being able to be very helpful. And then, of course, there's the stigma that the person who's facing the challenge might have about themselves. And I know that that can impact treatment. Dr. Halverson can talk to that one.
Yeah, thanks, Sue. I can certainly pick up from there. I mean, stigma has been something that I've tried to help people deal with for my entire career, and I know that's really what Sue has dedicated her life to doing is helping with this stigma. Stigma really does get in the way of people receiving help. Sue talked a little bit about weakness stigma, but there's a lot of judgment that goes on. Oftentimes it's people judging themselves or family members that want to do the best that they can for their loved one, but the way that they approach it really brings up other issues in their family member. So stigma, we know stigma kills. Stigma prevents people from getting the help that they need. And as I said, that's really the tragedy behind all of this, is because all of these disorders that we're talking about, a great percentage of the time, just like we can manage diabetes, we can treat your depression and your anxiety, but you have to be able to get help in order to do it.
Right. So it sounds like a lot of what I'm hearing from both of you is almost like we need to practice empathy when we're talking to someone about mental health, which is almost I'm feeling with you rather than I'm feeling for you, which is what sympathy would be. I think it's a great way to jump things off. So we've got some questions here and some things that I'm sure all of us have said to somebody at some point in our life. So now that we understand a little bit more about stigma and how mental health supports treatments and how that's all related, let's go through kind of some of these scenarios in terms of what you shouldn't say, and then maybe what would be something better to say. So one of the first phrases is maybe let's explain why we shouldn't say to somebody, I know what you mean. If you say, I had a panic attack when I saw my electric bill yesterday. Why is that something that you may not want to say to somebody?
So first of all, I'm going to go back to that self-awareness, and I'm going to ask myself, why would I be saying that? Why, when you tell me something that's really hard for you, do I want to minimize it with, my electric bill? And I think often it is because I don't know what to do with your pain. And so I unconsciously kind of need to minimize it so that I can be with you in it. I don't feel like I brought everything I need to be able to help you. And so once I realize that, I can recognize that as hard as it is for me to be with you in your pain, imagine what it's like for you to be talking to me about your pain. And so that just kind of backs me out of the situation a little bit and moves me more towards curiosity. So, if you're telling me something really hard, probably the best thing I could say in the beginning is thank you. Thank you for sharing this with me, because, I want to be here with you. Those are all just really authentic things to say that take me out a little bit of that conversation.
It removes a lot of the judgment too that people can feel if they're, I just told you about a panic attack I'm having, and I don't care about your electric bill.
Exactly.
And just because you've had similar experiences in the past, again, doesn't necessarily mean that you're having that experience. Everybody has a different, panic attack. Not only does that kind of downplay what you're saying, or maybe disrespects a little bit of what you're saying. I mean, you don't really know what they're experiencing right now. And by not listening and by saying that, you're bringing it back to yourself, not them. So, I mean, again, this is what we're talking about.
What if we say something to somebody almost to suggest things like, how about, have you tried yoga or meditation? Why wouldn't we want to say something like that?
Well, I think the positive piece, I'll start with that one, Sue. I think the positive with that is obviously you're trying to find something that's worked for you and trying to give examples of what's worked for you. Now, of course, we all know that just because it's worked for you doesn't necessarily mean that it will work for them. Sometimes people will take that, again, not necessarily as understanding how I'm thinking and feeling, but projecting your thoughts and feelings on me. And that's not always the best way to look at it. Again, I think you have to, you can give examples like that. And, I could think of a couple of different ways to say that where it could be supportive. I could think of a couple of ways to say that where it might not come across as supportive. And I think our goal continues to be to help be there and support the person and try not to come across in a way that's judgmental, in a way that's, sometimes I just want you to hear how I'm feeling without telling me how to solve it, or using things that have worked for you to tell me what to do.
Sue, anything to add to that?
It just, I think, like you said, sometimes we say these things, right? And once they're out of our mouth, we still have the opportunity to go back. I might say, what about yoga? And I'm like, that worked for me. I guess really what might work for you, right? So I've had the opportunity to interview a number of people who've been through some really difficult mental health challenges. And I was always looking for, like, what are the really schmucky things that people said to you? I wanted this list of never say. And what I heard from people going through this was, I could tell people were reaching out. Sometimes I wasn't even listening to their words. So, yeah, let's figure out the best way to do this, but let's keep reaching out even if we're not perfect at it.
Yeah. Why wouldn't we say to somebody, like asking them, well, why aren't you seeing a therapist? Or maybe even, why aren't you on medication? Why would that be something that could be harmful to say to somebody? Maybe it's something we shouldn't say.
Yes. So again, you're offering a fix, right? And that person may not be at that point to even think about that yet. And so it's always good to just say, what do you think would be helpful for you right now? Or, right? Just ask the question that you want to answer, turn it into a question. I do think if you want to bring up therapy, there are ways to do it. And I think this is kind of a gut knowing, but I've been in situations with people where they're telling me some really difficult things. And any person in our culture today would probably be asking themselves, should I be doing more than talking to Sue, right? So I may say to them, this sounds really tough, really difficult. I wonder if you're thinking there's someone beyond me that would be helpful to talk to. So again, I'm thinking therapist, but I'm not throwing that out there. I'm just trying to listen to where they're at and asking them, being more curious than telling.
Yeah.
But also bringing it up in a way where you're, this is something that's helped me. We talked about, there's risks and benefits to doing that, but obviously saying it in that way versus, God, you need a therapist. I mean, there are obviously different ways to say it that come across in different ways.
Sure. A popular question, I know a lot of people will ask this, and why would this not be the right thing to say, is just simply asking, are you okay? Why would that not be the right thing to say?
Well, yeah, at the end of the day, it's a very loaded question. It's a difficult question. If you're asking that, at work in front of a bunch of people, it might not be the right place to have that conversation. If you're asking that question, I'm hoping that you're ready for anything that might come with that, because that would be the other issue. You ask that question and then you get an answer and you're not ready for that. And that's and then that causes cause it to be even more more judgment, possibly more difficult place to have that conversation. Again, I think it's important that you're reaching out and that you're expressing concern about your friend or your loved one. And I think they want to hear that. I don't want to necessarily say, boy, you can't say, are you okay? Because that's a pretty basic thing to say. And I think most of the time people are going to take that as, you care about me and you want to hear. But I would just, again, make sure that you're in a place where it's appropriate, that you're ready for the answer that may come, because nothing is worse than, are you okay? Well, yeah, I've been having these panic attacks. Oh, well, I've had panic attacks when I get my bills. Ha, 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 ha. You have to be ready to be able to have that conversation. And again, not everywhere is the right place to have that conversation.
It's also a very closed-ended question and easy to avoid, especially as a man. Are you okay? Yeah, I'm fine. Move on.
Yeah.
You can easily gloss over everything that's going on inside and just dismiss it very easily.
Yeah.
What about when we say to somebody, well, there's lots of people who have it way worse than you do. Why would this be something you probably would want to say to somebody? Sue, you want to take this one?
Yeah, no. Yeah, that's a pretty obvious one, right? We don't want to say that. But again, let's go back and think about, why would I be saying that, right? I'm uncomfortable. And so that's that self-awareness. If I want to minimize, if I want to judge, and really, when I think about what I want to say is and what I'm thinking is, this reaction seems over the top to the situation. That's what I'm thinking, right? And so I'm going to say something comparative. Why not just say, this seems really tough for you, right? Just name what it is that the person is feeling and expressing. Keep all that other stuff back there, and give them more time to talk about it. Sure. I mean, it is a sign when you sense that someone is kind of over the top on a situation that they would typically handle really well. I mean, that it's reasonable for your concern to be raised, but how you express that is important.
Sure.
And I think it's also important to kind of, again, think about what depression is. Again, when I have, if I have diabetes and my blood sugars are high, I guess people could ask me why your blood sugar is high. Well, I guess I ate some things that I didn't, and that doesn't come across. It comes across, I think, equally well as this. I mean, obviously, depression can be caused by what's going on in people's lives, but that's just really one part of what causes depression. There's a genetic aspect, there's a biochemical aspect that has really nothing to do necessarily, other than sometimes being triggered by what's going on in your life. And if I have, there's different people have different levels of what we call resilience. I could have the same stressor as Sue does, and it could really set off a depressive episode with me, and it doesn't necessarily mean that that I'm weaker than Sue, or that I have I have other. It's just that I have a biochemical predisposition, I have a family history, and there's other types of supports that might not be firing at all cylinders in my life. I might be using alcohol or drugs or other things that I could be doing that might kind of lower that threshold a little bit. So by saying, hey, people are a lot worse off than you are. I mean, obviously there's judgment in there, but it's also just it's not a nonsensical question. Why is your cancer so bad? Why is your, it's not something that we should feel that we should ask.
Sure. When you rephrase it like that, it makes a lot more sense. When you relate a mental illness to another thing like diabetes or cancer, the question doesn't make much sense.
Yeah,
really
and we know that.
Yeah,
we
I
really
just said
know
you
that
really avoid comparisons.
Yeah.
Yeah, I mean, because depression is, again, it's a medical illness like other medical illnesses. It's a manifestation of an illness of the brain, and it manifests differently between people. And again, it's not very different than diabetes, and it's something that we as psychiatrists say all the time. The pancreas isn't working well, or some of the other some of the receptors in your body aren't working well. Again, here there are parts of the brain that aren't firing on all cylinders for various reasons. It's the same type of thing. It just manifests with different symptoms. It just shows different symptoms.
Sure. And kind of bouncing off that with the whole manifesting things in our brain, it's kind of a difficult subject for some people to talk about. I myself, as an advocate, don't feel like it is, but there's a stigma around suicide. And how do we talk to someone about suicide when we have a friend that we think may be in that place, in that headspace, if we're concerned? Dr. Halverson, what's a good way that we can talk to somebody about that?
Riggs, I'm really glad that you brought up suicide. I think suicide is an important thing to talk about, and I think the more that we talk about it, so there's nothing really more stigmatizing, maybe substance abuse, but there's nothing with more of a higher stigma than suicide is. And I think the more that we talk about suicide, the easier that is that it will be to talk about it, and it will help with the stigma. I know there's a concern, and I've certainly heard this when people come in. I'm afraid to talk to my loved ones about suicide because I'm worried that they're going to be more likely to commit suicide, or I'll give them the idea that of suicide. And there's actually been studies that have looked at these things, and that's not the case. Oftentimes, by bringing up suicide, people feel that a higher sense of empathy. They feel that you kind of maybe understand more where they're coming from, because people have these thoughts. Whether they're going to act on them or not is a different story, but everybody has thoughts about suicide at times, whether they're fleeting or not necessarily that they're going to act on them. But we know that talking about suicide doesn't cause people to have suicidal ideation. Again, in fact, it helps people feel that you maybe have a better understanding of maybe where they're coming from, or it also can help them, if they're not having those thoughts, it can also help internally reframe things. Well, I guess things could get worse, because sometimes when you're depressed or you're anxious, you feel like things could get worse. Like, well, I'm not having suicidal thoughts, and that's a good thing. So it's a really important thing to talk about, and the more that we talk about it, the easier it will be to talk about it. So I'm really glad that you brought that up.
Oh, thank you. And it's important not to be afraid to ask if someone's thinking about suicide. It's saying the word keeps it out there, and it strips away that stigma. So.
No, every patient that I see, I ask about suicide, and obviously it's my job, but it's an important thing, and obviously it's a scary it's a scary topic, particularly to talk to your friends and family. And once again, don't ask a question that you're not ready for the response, and be ready to support if that's positive, or if they're having these suicidal thoughts. But I'll also tell you that just because someone's expressing suicidal thoughts doesn't necessarily mean that you have to call me or get them to a psychiatrist right away. Having suicidal thoughts is a common condition of being a human, but obviously if people are having thoughts that I'm going to act on this, or I have a plan of how to do this, then you start getting concerned. But obviously just having suicidal thoughts, feeling overwhelmed, feeling like I wake up and sometimes it would be easier if I weren't alive. That's what we call passive suicidal ideation. That those are suicidal thoughts too. So there's a whole continuum of suicidal thoughts. And again, it's important to get those out in the open if they're there.
And there are resources out there like the Suicide Prevention Lifeline, 1-800-273-8255. There's the crisis text line. You can text hello or help to 741-741. And that's not just for somebody that's in crisis. That could be for you if you have someone that you feel may be in crisis. You can call right there with them on the phone and feel comfortable that you have someone on the other end of the line that can help you talk with that person in that that time of need. So know that resource is there. And it's not just for someone that's in crisis. It could be for you with that friend to call in that moment. So I think it's good.
And we know that most people that end up committing suicide have told somebody within that past month that they were having these suicidal thoughts. And it's generally not their doctor. It's generally not their therapist. It's a family member. So it's an important thing to hear.
It is true. And with people dying by suicide, still the 10th leading cause in America, let's make sure that we keep that in the forefront. Thank you for your answer to that. I appreciate that. So now we've kind of reviewed scenarios as far as what we as as helpers, like you said, Dr. or Sue, we should not say to other people. But what if we flip it to the other side, where you are the person who has these questions asked of you? Like, what do we do if somebody says something to us when we're hurting, when we're struggling? How do we cope with that? And how do we react to that person when they're asking us these questions?
Yeah, I think probably the best tip I can give people who live with mental health challenges, if they've engaged somebody and that person says something that's pretty stigmatizing to them, that, something they didn't want to hear, is to think about, what were you hoping for? So, I come to you, Riggs, to talk to you about something that's going on in my life, and you say something back to me that, this.
Everybody
just
has it
to
worse
say to you,
too. People have it worse.
Yeah, exactly. And so I would say to you, so my reason. So I would just simply say, oh, I was looking for non-judgment, right? Or I would say, well, I was really hoping you could hear me out on this one.
Yeah.
Sometimes just letting the person know what you were hoping from is kind of a gentle way, so you could say, well, I'm sorry, I really do want to listen, right? So responding with what you were hoping you would get. And then, of course, there's the stigmatizing things that happen where you haven't engaged the person, where the person chooses to say something to you, and you get to let them know that they don't get to be in that conversation, right? So, and you can do that in fairly gentle ways, but so you're cruising along and you're talking to somebody and someone else says something that's pretty stigmatizing. It's really okay to say, not the time or place, right? Or don't need to hear that right now. I had a 12-year-old boy who had been through really significant mental health treatment, was out of school for 3 months and came back to school. And first of all, the school had a party for him, just like they would have had he been out with cancer treatment, right? There weren't any secrets about it. He was away getting help with his mental health. They had a party for him. He was out in the playground talking with some guys about it. And one of the other guys came up and said something negative to him. And he simply held his hand up and he said, you don't know enough to be in this conversation. And I thought, wow, good for you.
12-year-old kid said that?
Yeah. We have a lot to learn, right?
Oh.
Yeah.
Well, I know we've had some questions that have been coming into our Facebook comments section. We can go ahead and kind of answer those right now. I think our first one may go to Dr. Halverson. So what do you say to a patient who says, I'm not happy. I don't know what will make me happy? What would you say to somebody that asked that question?
Well, I think part of what we have to do is continue to reframe, what happy is and what happy is for different people. I think people can have a satisfying life and be engaged in many activities, and not kind of have this, I'm married with 2.5 kids and, you know, have the job that I want and I love. I think our goal continues to be to get people to have a satisfying life. I think this ideal of being completely happy is kind of a fallacy. It is a fallacy. I think most people have times in their life that they struggle. They have times that they enjoy. They have things that they enjoy doing. The important piece is to kind of tease out what you're looking for, but also whether, you know, you're depressed or whether you're just not satisfied with your life. I mean, those are totally different things and have different outcomes and have different treatments to get there. You know, you don't have to be completely happy your entire life. And I think there's this thought that there are people out there that are walking around with smiles on their faces and songs in their hearts. And, you know, if those people exist, you know, God bless them. I don't know any of them. And some of them might be, you know, what we would call faking it till you make it, and, you know, being positive, and that's cool, and that's great. But again, I think there are people that have these expectations of life that we really have to try to help. I mean, our goal is to help you live a functional life to where you're able to do the things that you enjoy. You're able to have the relationships that you want at work and at home. And you're able to focus on self-care, taking care of yourself, doing things that you enjoy. I mean, that is a full life right now. Whether you're, you know, grinning ear to ear, 10 out of 10 on the smiley scale every minute of your life.
And we don't compare people's social media feeds to happiness either, because I think those are highlight reels of people's lives. And a lot of times we scroll and see happy vacation pictures, people with their kids playing and having fun. Nobody posts pictures of tantrums and, you know, crying alone in a corner. Nobody ever posts that on social media. And people can get these clouded glasses kind of view of what happiness is, when I think you hit it right on the head. It's kind of, you can't just always be happy. Sue, we had a kind of a question for you. This is kind of a loaded question, so follow me on it a little bit. How do we reinforce that they have tools and resources like a community available to them so that they feel supported without minimizing the challenge or the pain of their experience? So essentially, how do we remind them that they have advocates without creating the impression that the impact of their pain is being bypassed? Does that make sense?
Sure. For me, that I think of timing on that one. Have you spent enough time listening? You don't start with resources. That's quick fix. Is this person, do they believe that you've heard them? And are they open? And sometimes I suggest that you ask for permission before you make a shift. You know, Riggs, I've been listening. I hope you felt that I care. I have some thoughts. I've heard from some other people some things that are helpful. Would you like to hear them? It just, because yes, you want to offer resources, but you want to balance that with really offering that space. That answer it?
Yeah, I think so.
You can push me if you need to.
Well, it's great because it doesn't minimize their feelings, which I think is what you were saying. You're not just passing the buck to someone else. Well, here's the Lifeline number, go call this, or here's Rogers' number, go to RogersBH. Go to their website. I think you answered very well there. What do we say to someone who's maybe struggling with mental health, who doesn't use the resources that are available? Maybe they want help, but they're not taking action themselves. Or maybe you've offered that, and maybe they say that they care themselves, but they also complain that no one is helping them. I mean, what do you do with somebody that's a little kind of spinning their tires a little bit, I guess you could say? What do you do, and what do you say to someone like that?
I think part of that is the disease, and happens commonly. You know, let's take depression. If you're depressed, your energy is poor, your concentration is often poor. You're not sleeping, you're worried about things, you're concentrating on things oftentimes that you can't do anything about, and that's making you spin your wheels worse. So I think those particular cases, it's even more important to try to be supportive, because I think if you would ask them, they feel like they're trying and they can't do it, even though from an external view, you would look at them and say, well, you know, you're not making that call. You got to do this yourself. You know, there's been a kind of an old kind of mental health trope that you have to be able to want this for yourself. You have to make that call yourself. And there's really some truth to that. But again, we also have to understand that due to the illness, it's going to be really challenging for some people. So I think it's important, as we're talking about, to continue to be supportive and to try to meet the person where they're at as much as possible. And doing that without judgment sometimes will mean that you'll say, oh, can I come over and get on the phone with you, or I can be there to make that phone call with you. I'd really like to help you do this. And not everybody's going to want that. Not, people are going to think, hey, you're pushing this too hard, but all that you can do is try to be as supportive as you can.
Sure. Another question we have here from our comments, and this is kind of a heavy one, but I would be interested to hear both of your takes on this. Can you give a few examples of warning signs of suicide? And I think this is interesting because one of the main signs, I think, is withdrawing from, activities and doing regular things, but we're kind of been doing that by nature with COVID and quarantine and staying in our house and staying home and being safe. So what are some examples of what might be warning signs of someone that could be, contemplating suicide or thinking about that?
So first of all, they might want to talk about it. So take seriously the words that they say. I wish I wasn't here. Stop and hear those words and be able to have a conversation with them. Kind of the standard ones, giving things away, kind of putting their house in order. I've lived with someone who's made attempts on their life and have noticed that they're having a really difficult time and then seem to be doing really well, kind of unexpectedly really well. And that can be a sign that they've made their mind up that they have a solution, and it's not the solution we want them to choose. So staying connected, watching out. What other ones come to mind, Dr. Halverson?
I think people think so. I mean, I think folks that are experiencing depression, it's certainly not the only reason that people kill themselves, but having a history of depression, particularly if that depression's not getting better, having other things like chronic pain that's not being well treated. There are a lot of other kind of medical factors that might make people more likely to do it. You'll find symptoms of depression. You talked about the withdrawal. Oftentimes people that will complete suicide have had suicide attempts in the past, and suicide attempts really need to be looked at as risk factors. People that have had losses, coming out of a divorce, losing a job, having a significant loss of a significant relationship, having other types of stresses in the family. Oftentimes, people that will complete suicide are struggling and have these discrete losses that if they're telling you, or if you're able to see that, you oftentimes look back and say, boy, those are significant losses. Although again, that doesn't happen all the time. And there's a percentage of people that aren't going to say anything and don't want people to know. And that's again what makes it even more challenging for friends and family.
Sure.
I like to think about it as if they don't already have a diagnosis, and if you're not kind of in that world of mental health speak with the person, to think about psychological pain. That they're just the things that Dr. Halverson listed put people in a place of psychological pain. And so I've heard people say, well, they didn't have depression, right? You don't have to have depression. It can be just acute experiences of pain that people have.
Sure.
And I also wanted to add substance abuse is a significant factor here. People, if you ask folks, I would never do this to my family, I would never kill myself. Well, when you're intoxicated, you're thinking about that a lot less. Oftentimes people would use alcohol or other drugs to kind of lower their resistance to the thought of suicide. So having someone that has a history of depression, some medical disorders, some substance abuse disorders, I mean, that's really a mix that's concerning.
Sure. Another question we have here in our comments: what do we do if we're having a conversation maybe with a group of people and someone in our group we know is having a mental health struggle, but there's of course that stigma there. So how do we support the loved one or our friend maybe in that group when comments are made that kind of perpetuate that stigma and we're in more of a group situation, I guess? I think that's what that question is alluding to.
I think you have the opportunity in a group situation to be someone who stands up against stigma, to model. I think about you're sitting there with 6 people and someone says something that's really inappropriate. You don't know what the other people in the group are feeling, and this may be the opportunity that they see you as a safe person, that you're willing to say, really, that's not how I understand this. That there may be someone watching you and deciding that, oh, okay, Sue may be safe for me to talk to.
Sure.
And I feel, positive, the stigma obviously is a significant issue for everybody. But certainly, as I've gone on in my career, and I'm taking care of more of our younger folks out there, the stigma and the acceptance of you as a human being, how you're feeling is just so much better and more healthy in the younger ages, although there's still work to do than it is for the older age group, which is again challenging because we have 2 peaks of suicide. We have suicide of teenagers and young adults, and we have peaks in the 60s and above. So that makes it again even more challenging for the older group, because that is a group that we've had to continue to work with stigma, because growing up there, it's the lift yourself up by the bootstraps, deal with it, don't talk about it. And we're, that's what we've been working against. But again, I do see lots of hope coming on the horizon. The young adults and younger are really much more open to having these conversations than they have been in the past, which I think is a really positive thing.
I'm glad that you brought up the age gap there, because the next question kind of leads into that. Is there anything we should do differently when talking to the elderly or older people about mental health? How do we discuss it with them when we have that stigma, like you said?
I think one of the problems with stigma in people that are older is they could have lived their life not being touched by mental health challenges. They could have it could be a very caring person, cared for lots of people with mental health challenges, but have defined themselves as, this doesn't touch me. And so I think being really clear that you can experience mental health challenges at any age, and more communication from people who have gone through life without the experience and then experience and have a positive outcome, that those are some stories that aren't typical for us to share. We think more of, if you're 50 and you have a mental health challenge, your life must have been full of that, versus people who have some psychological pain in their later years and can't see it touching them.
Yeah, it's a challenge though, because oftentimes when you take care of these folks, they'll say, "Oh, I don't have any family history. Oh, I haven't experienced." It's because nobody talked about it. It was a secret. It was a secret. You would fight hard to make sure people didn't understand. Yeah. Well, you would fight hard to make sure people don't know what you're dealing with. And, as you talk to them more, it's like, oh, well, yeah, I might have had an uncle that was in an asylum, and there's some of that stuff that's there, but it's not as helpful to get because again, you ask a 32-year-old any family history of psychiatric issues. Oh, my aunt, my uncle, my cousin, they're able to kind of list it out because the conversations and people are paying attention now. Whereas, if I have someone, well, I have really no history, and we know with how common mental illness is, that the chances are very good that someone, if you live in a family, if you have more than 3 people in your family, the chances are very good that someone in your family tree has dealt with mental illness. And also, again, even if it wasn't brought up, the treatments that we had in the past aren't as effective as they are now. So it might not have been talked about.
Sure. Yeah. I think this question is for Sue. Somebody asked, how do we talk to someone specifically who may be struggling with addiction? That's something that we've kind of talked on. And Dr. Halverson, you said that's probably one of the big ones that has a kind of a stigma behind it. So how do we talk to somebody about addiction, specifically a loved one?
I think we want to use the same language we would use with a mental illness and not separate it out. I think when I think about stigma, the language that we use, just listen to our news and how, someone is an addict, right? Instead of someone's faced challenges around addiction. We just start from this base of there's something wrong with the person versus the person is dealing with something that's very challenging. So I think how we talk with that person has to come from that context. In conversations that I've had with people who, are considering that maybe their drinking habits aren't helpful to them, it's really letting them, creating a safe enough space for them to be able to talk about the ups and downs of their use. And I think a lot about what's called the stage of change theory, that before someone makes a change, they have to get to some level of appreciation for what got them to this place and a desire to move out of that place. And so our conversations that can be less judgmental and more present and helping them to kind of tease through that. Is this working for you? Is there hope that what would life look like? For people who've spent their life using alcohol in all different kinds of ways to minimize some of the things that they're experiencing, that's a really hard thing to imagine. What's life like without this in my life? And so we can give information and support in ways that are non-judgmental and hopeful.
Sure. Another question we have here is how do we move?
I think the other piece with that, no, I'm sorry, another piece with the substance use is I think we have to also understand, like depression, substance use is very common in our culture right now, but differentiating between substance use and substance abuse or substance dependence is a difference, but use of substances are very common, and I think it's important, as a mental health provider in particular, or as any healthcare provider, it's really important to ask those questions. And I've always been struck from the beginning. Well, how many, how much are you drinking? And kind of depending on where they're at, oh, not much. And then if you kind of let it go there, you're missing the point, because then you ask another question. Well, how much is that? Well, about a case a day. And it's not much because they used to drink a lot more than that. So I think it's important to ask the questions. It's important to be specific. And as I said, it's unfortunately tremendously common in our culture. So it should be part of the conversation. I mean, since you're bringing up substance.
Sure. We had a question here about kids, how there's a myth out there about the resilient child is what they've called it. And so, children can experience psychological pain just like any adult can. So how do we kind of move beyond this myth of kids are bulletproof and, they're going to be just fine if that myth is out there? How do we move beyond that or deal with it?
Do you want to take that one, Dr. Halverson?
Sure. I mean, again, I think kids, even if kids were just little adults, they would still need help, just like the other adults. But we know childhood is a pretty significant time. Things that happen during childhood, you will be dealing with for the rest of your life. Things that happen during childhood helps you shape the type of adult that you are or you can be. We know for things like post-traumatic stress disorder, if you have traumas in childhood, you're more likely to have traumas that are significant in adulthood. So identifying and treating mental illness in children and adolescents is crucial. I would say it's sometimes even more crucial than adults, because adults are basically formed by the time you're an adult. And you have the way that you're going to be, and you're a little bit more resilient to some of the things, some of the insults that might happen, whether be they physical or emotional. Whereas if you're a child child or an adolescent, you're still forming who you are as a person, and how you think about things, and how your brain is working, and how your brain is getting put together. So if you do not treat those, again, you can have lifelong effects. Just like if you treat them, you're kind of minimizing the chances that those lifelong effects are going to take hold.
Sure.
I think of the word resilient for a child. It's not the resilient child, right? It's how do we help the child to experience the ability in small increments to deal with what life has dealt them, whether it's a genetic mental illness, whether it's trauma that's happened to them. And for me to just say resilient child, almost like you said, it's like, oh, they'll bounce back, they're young, it doesn't matter. My job is more to help them to see their ability to make positive steps in their life, so that they begin to see themselves as able to grow and change and deal with what has been dealt to them. So yeah, we have to be careful with that word resilient when it comes to kids.
Sure.
And it's equally it's obviously important to look at the whole unit when you're taking care of adults, but obviously with children, there's a lot of things you really have to look at the whole household and treat the household. You have to, so that brings up issues like, are they getting adequate supports during the day? There's equity and access issues that are super important to be able to address. But it's not just that you're able to look at treating the child. We bring the family in, even for adults. If we're treating people, the treatment always goes better. We want to recruit the family, make sure the family is getting their needs met, because some of the things that are going on, as we talked about genetically, if the child is having struggles, there's a pretty good chance that someone else in the household is having those struggles too. And if we want the child to be able to continue to move forward in a more healthy way, it's important to try to support the whole family and have the whole family involved in the treatment as an ally.
Yeah, we've got a lot of questions. We've got another one here. This one's about prescriptions and about medication. How do we get someone to focus on the benefits of the prescription rather than the side effects? Someone said their son can't move past the negatives that they're reading about on the internet, and a lot of people have that stigma around medication. It's just going to make me like a zombie. How do we get people to focus on the benefits of that?
Sue, I'll take that one. So this comes up a lot. The first piece that you want to make sure are these. It's easy if you're looking on the internet, and what people remember are the bad, the worst events. If you're looking somebody up on the internet, I took that medication and it had a big issue. You're not hearing people on the internet for the most part saying, "Oh, I had a fine experience with that. It really helped." There are some that are really positive and really negative, but really what you remember is the negative. All of these medications that we use that have gone through the FDA process are safe. Now every medication has side effects. So what we do is we really attempt to make sure that the benefit would outweigh the side effect. We want to really be able to have that conversation with the patient or with the child to make sure they understand if they're having side effects, they should talk to us about it. It's important to be clear what are the most common side effects right now, and what will happen if those happen. If the kid is, in this case, really concerned about side effect and can't get past that, that could be an anxiety disorder in itself that would need to be looked at. It could just be, again, an education thing. But ultimately, when we are weighing the risks and benefits of medications, we know medications can be helpful for a lot of people. And if we're talking to you about medications, it means that you're really struggling, that there's stuff going on in your life that we feel that this would be helpful. So our goal continues to be to try to make sure they understand the possible benefit. And no medicine is a silver bullet either. At Rogers, we oftentimes combine medications and therapy. There are some people that refuse to take medications that do well with therapy. It kind of depends on where you're at on that severity range. But it's important to have those conversations because medications can have side effects. But for the most part, their nuisance side effects, and people once they start feeling some of that benefit are fine with the fact that sometimes in the morning they have a little bit of nausea, but generally if you're going to have side effects, it happens kind of really early on in the course, and your body tolerates to them over time.
Sure. The next question is that's a nice general question. I can input on this as well. If I'd like to hear your input as well on this. What are some ways that people can help advocate for mental health and help make a difference? Are there volunteer opportunities out there? Mental health awareness is something I'm passionate about. So this person wants to get more involved in helping kind of do what we're doing here today.
So one suggestion is to go to wisewisconsin.org. WISE is a collaboration, a coalition of organizations across the state. It's a good way if you're not connected into the mental health advocacy world. There's a lot of free resources on wisewisconsin.org, and you can sign up to be on a newsletter that would get you to coalition meetings and a chance to meet other people that share that same drive for advocacy.
Mm-hmm. There's NAMI all across the nation. NAMI, National Alliance for the Mentally Ill, is very good. There's also resources at Mental Health America, MHA. Those are two great resources. I know my specialty organization, the American Psychiatric Association, has a lot of kind of education related items that can help people get engaged.
I know I work a lot with the American Foundation for Suicide Prevention, who has a local Wisconsin chapter. They've got a lot of great local opportunities for helping with programming, even helping with advocacy on the legislative level. So you can go and help work on bills like getting the 988 number passed for the National Suicide Prevention Lifeline number. That's something that we all lobbied for years with the American Foundation for Suicide Prevention. And sometimes doing legislative things and talking to your local Congress people, your local alder people, can help create change in the mental health community that really makes a big lasting difference. That advocacy, I feel like, is some of the biggest things you can do is on a legislative level to make things, equitable and making mental health more accessible to people in lower income areas and, across the country. So there's lots of ways you can get involved. And
I just want to, and I also just want to add back to, that question before, when you're in that group of 6 and somebody asks for help and somebody else responds in a poor way, that, in your community, in your family, that is a terrific way to be able to make a difference and start to change hearts and change minds by saying something, even at that very extremely local family level. We need everybody to do that. More people that do that, the better off the mental health of America is going to be.
Sure. Our next question is kind of a heavy question, but they're asking, how would you deal with an 11-year-old dying by suicide? You've got a much younger child, somebody that's obviously dealing with this. They're kind of wondering, how can they cope? If there's any resources, what would you say to some of this? I can add to this as well if you'd like.
Can I take that, Dr. Halverson? Looks like he might have frozen, so I'll take this one. First of all, whoever asked that question, really sorry for your experience. That's a hard one for all of us to wrap our brains around. So I'm glad that you asked the question. I know for me, I would need to be connected in order to be able to deal with it, connected to people that kind of the no BS people in my life who would know how to support me. And I would be looking for other supports. I know in our local area, our Mental Health America has a couple support groups for people to come together who have experienced loss to suicide. And, all of us feel differently about those kinds of resources, but I think connection would be my number one to be able to walk through that. Dr. Halverson?
Yeah, I think connection is very important because there are people that have experienced what you've experienced. It's also important, though, to make sure that you're taking care of yourself and that, it doesn't happen all the time, but obviously there's around suicide, let alone a suicide of somebody that young, there's lots of feelings of guilt. What could I have done differently? Is this my fault, or is there something that I should do? And I think that's a really really important and crucial time to make sure that you're getting the support that you can, that you're continuing to try to find some things that you can do. Obviously, that's a huge part of your life that is gone. You have to still, though, try to take care of yourself, try to find just basic, try to find enjoyable things. You know, that is absolutely an event that could cause a lot of people to spiral in a very unhelpful way from a mental health perspective. So just, again, continue with the basics and trying to make sure that you're taking care of yourself. Getting connection, like Sue is saying, I think is super important.
I've led one of those support groups with Mental Health America, so I myself have lost family members and loved ones to suicide, and that's the best thing you can do is be there with people who've walked that path, and also to let yourself grieve in your own way and not question your grief. I know I've talked to parents that have lost children that felt relieved that their children died, and is that bad that I feel relieved that my child died by suicide? And it's not. It's part of the grieving process. All of your emotions, you're valid in what you feel, but getting that connection is really important. So I think we've kind of run out of time almost. We're almost at an hour. So if that's okay with you guys, I mean, I've really appreciated your time. Is that all right with us? We kind of wrap things up here. I think we only had an hour. So perfect. So thank you all for your questions. If we didn't get to your question, please reach out to Rogers directly. We'd be happy to answer it that way. It was helpful learning a lot from you, Dr. Halverson, and Sue as well. Thank you so much for your time. And more information on mental health and addiction and treatment from Rogers provided at rogersbh.org. And for helpful resources like videos and blogs, rogersbh.org/resources. Stay well, be kind to your mind, and thank you so much for watching today.
Thank you.
Thank you.